Stuart Young, and the Chief Medical Officer, Dr. Roshan Parasram. It is my responsibility once again to share the latest data as to where the world is with COVID-19. The data has to be contextualized in the recent statement put out by WHO, which states that the WHO thinks that we are still in the first wave of this global pandemic. This is WHO's latest communique, their latest advisory, their latest warning, that as a world community, we are still in the first phase. And in that first phase, there are now globally 5,717,726 cases around the world. Let me tell you why this figure is so important. Ladies and gentlemen, you may recall at earlier press conferences, I would have indicated what was the caseload per million units of population. That breaks it down so every country can evaluate themselves per million. I distinctly remember maybe about a month ago when I started giving that particular statistic. Caseload per million, the global caseload per million was around 120. So that means for every million people around the world, you would have about 120 cases. The caseload per million today is now a staggering 733. It means that in that space of time, for every million population, the number of persons with COVID-19 has gone up from 120 to 733. That is what, about a 500% increase, if my math is correct. And this is where we are today with 5.7 million cases. And we are a part of this global pandemic. Deaths to date, unfortunately, 352,983. Those are 352,000 persons who were alive and who probably most likely died prematurely. Families are in mourning. Children have been left without a father or a mother or a grandparent. And families have been plunged into despair and mourning. In the local context, since we started reopening the economy on May the 11th and taking baby steps, and then we took a major step last week, Thursday, when we advanced phase 2 and opened up manufacturing, opened back other aspects of the economy. A lot of the onus for how we respond to this global pandemic now rests with the population, with individuals, with families, and with groups. In the last couple of minutes I have for this initial report, we need to reiterate that the measures that we are asking the population to adopt are very inexpensive but can save lives. This simple habit of wearing a mask, covering your nose and mouth, this simple mask is telling the country and telling your fellow citizens on Brian Lara Promenade, on Cureb Junction, in the Arima Dial, Harris Promenade, the Esplanade in Tobago. This simple mask tells the country that I love you. It tells healthcare workers, I appreciate you, and I don't want you to have to treat me and expose yourself to the virus. This simple mask tells your parents at home, I love you. And that when I go out and I wear a mask and I wear it properly, I don't get the virus and I don't bring it home to my children, to my parents, to my grandparents. It's a sign of love. This simple mask. It's a sign telling your fellow citizen of Trinidad and Tobago, we are in this together. The mask is to be worn like this, covering your nose and mouth. The mask has absolutely no value like this, which is what I am noticing. No value like this. Absolutely none. This mask, covering your nose and mouth where the virus enters, is the armor and the shield of protection that we have now. It costs nothing. You can make it at home. Simple piece of cloth with 2 pieces of elastic. The other armor that we have is this. Hand sanitizer, which is now relatively inexpensive. You know, clean your hands as often as you can. If not with hand sanitizer, with simple soap and water. You don't have to buy expensive sanitizers. You don't have to be out of pocket. Your regular bath soap at home can work. Sanitize your hands. Wear a mask. Don't touch your face as often. I have cut it down a lot, but I still make the error every now and then. It's a difficult habit to break. For employers and employees, and I don't know if we could put up the graphic with the mask lady and the 6 things, if it's possible, just to remind the population. Staying home when you are ill. Staying home when you are ill is absolutely crucial. And placed right, and that is the new normal. Wear a mask. Keep 6 feet away from people. Wash your hands. How we cough. Avoid touching your face. And clean and sanitize hard surfaces. Thank you very much for putting that back up. Thank you very much. Ladies and gentlemen, a lot of these measures don't cost money. The simple napkin for when you cough and sneeze. You cough and sneeze into it and discard it. Don't cough and sneeze into a handkerchief which you then put into your pockets and then you reuse. These are disposable. Every house, I think, has napkins in it, paper towels. Walk around with some. Walk around with some, so even when you're in the public and you want to open a door, push a door, you could take this out and use this to do a handle, push a door. Protect yourself. These simple measures, ladies and gentlemen, will prevent us from adding to this 5,717,000 cases, 726. And hopefully, our contribution to the 352,983 deaths can stay at 8, as unfortunate as those 8 were. So, Minister Cox, I thank you for the last couple of minutes to simply reinforce these simple, inexpensive public health measures that should now be our individual and collective responsibility. Thank you very much.
Thank you very much, Minister. The Chief Medical Officer, Dr. Roshan Parasram, will provide us with a clinical update. Dr. Parasram.
Good morning, Honorable Ministers, members of the media, members of the viewing and listening public. The clinical update for the 27th of May 2020 is as follows. Samples submitted thus far to CAFA as well as the UE lab, 3,046. Number of repeated tests, 417. Number of unique patient tests completed, 2,629. Number of positive tests remain at 116. Number of discharges remain at 108. Number of deaths remain at 8. Within the parallel system, as it relates to quarantine facilities, we now have 85 persons quarantined thus far. At the UE St. Augustine Debe Penal Campus, there are 59 individuals. At Cascadia, 5 persons, and within the Tacarigua facility, there are 21 persons, all of who have been sampled as to national protocol for quarantine and are negative. With regards to the private labs, I just wanted to give a brief update. So as of yesterday, we would have received a 6th application to join the quality assurance program. So that was received, and that person will be added to the list of other individual organizations that have asked to be tested. So that 6 person will now begin the process as it relates to inspection, looking at the documentation, and then of course it will culminate with a PT panel where they will actually be asked to run a test, a simulation. So in terms of the other 5 labs, 3 of the 5 has said to us that they are still not ready to receive the PT panels. The other 2 labs have received them, and I'm awaiting a final report, which should come in the next day or 2 for those labs, and then we will make a decision thereafter, or at least as if their quality assured from the Ministry of Health point of view. So, Minister Cox, that's my update for today.
Thank you very much, Dr. Parasram. The Minister of National Security, the Honorable Stuart Young, will address issues related to the borders and the management of our nationals who are returning. Minister Young.
Thank you very much, Minister Cox, Minister Diyal Singh, my cabinet colleagues, CMO Dr. Parasram, and members of the media and the wider viewing and listening public. I'd like to start off this morning's briefing from my perspective of assuring all of our nationals who are not in Trinidad and Tobago that want to return, you will be permitted to return. As we've said, and as I would repeat here this morning, what we are doing is we're very carefully managing the process. And believe you me, we do understand the difficulties that each and every one of you nationals faces who are outside of Trinidad and Tobago wanting to return, as well as your families and what it is you're going through. As I personally sit and read the hundreds and thousands of applications, each one tells a story, and we are very aware of at the government level as we continue to manage the process. So I'd just like to explain it very briefly to you all this morning. And I'd like to start by reminding that the COVID-19 cases in Trinidad and Tobago were all imported. The 116 cases were all traced back to importation. Out of those 116, 52 came off of a cruise ship, and persons who were infected by being on that cruise ship, and they came back in Trinidad. We, the citizens, have managed this well by listening to our medical health experts, and we've reached a point where we've begun to reopen the economy, but also manage more and more of the return of our nationals. And I'd spend some time on that process this morning. On the 30th of January, you all will recall, we took our first precaution, which was travel restrictions with persons coming from China. Over the next few weeks, as we continue to monitor it based on our medical health experts, we added a number of countries with travel restrictions. Then on the 12th of March, 2020 of this year, we announced a decision that we were no longer permitting cruise ships and persons to disembark from cruise ships onto Trinidad and Tobago shores. On that same day, we asked persons to only travel if it was absolutely necessary, essential, or emergency travel. That's the 12th of March. On the 17th of March, we took a decision to close our borders to non-nationals. This was followed, again based on the advice of our healthcare professionals, whose advice we have been taking in a measured way. On the 23rd of March, we closed our borders to all nationals and non-nationals on the 23rd of March. These measures were critical in our management in preventing the spread of COVID. By then, we had received an importation of a number of cases. Fortunately, our parallel healthcare system built out to deal with COVID was able to handle those. And again, kudos and thanks to all of those in our healthcare facilities, our frontline workers, who did a remarkable job in managing that process and getting us to where we are today. The purpose of closing our borders was to allow us, the government, to protect you, the population in Trinidad and Tobago. This virus, as we've said time and time again, and it's worth repeating, is spread by contact. The virus, as I said a short while ago, and I will repeat, is imported into Trinidad and Tobago. So by shutting our borders, we were able to ring fence our population in Trinidad and Tobago and manage it very carefully by combining a number of measures to get us to the point that we are at now, where at this date, fortunately, we don't have any positive cases in our healthcare system, so we're managing the opening of the economy and the return of our nationals. In allowing the entry of our nationals, it was advised, we were advised, and we took that advice, that to manage the possibility of the reimportation of COVID-19 and to minimize its spread, we will need to quarantine persons and quarantine the returning persons as opposed to allowing them to go home and self-quarantine. This is a critical pillar of our continued management of the entry of nationals back into Trinidad and Tobago. And we've seen how it is working as we go through a number of cycles. If we were to just permit individuals or nationals to return and go straight home, we risk this potential spread, community spread of COVID in our communities. So the advice that we've accepted and that we're working with is that we will state quarantine those persons returning to Trinidad and Tobago, and in a number that we could manage, if God forbid, there turns out to be a reimportation of the virus, as may happen, and it doesn't overwhelm our public health care system. I'd like to explain the procedure that is currently applicable. Each case for an exemption, request for an exemption, is considered on a case-by-case basis. We are managing very carefully the return of our nationals and ensuring, importantly, that our public health care system is not overwhelmed and that we can handle it. As I just explained, the state quarantine process is an essential and critical pillar of our continued management. We don't want to overload our resources. This is being done to protect not only those who are here in our population, but also those who are returning. Another critical part of the formula, as advised by our medical experts that we've accepted, is you don't want to mix persons. So you don't want to mix 5 persons coming from one area with another 10, etc., and therefore potentially expose them to spreads that they may not have had otherwise. We have thousands of applications, understandably so. As we said time and time again, there are over 330,000 nationals of Trinidad and Tobago outside there. We are receiving thousands of applications from all over the globe. Just as I walked in here this morning, I was reading one from somebody in the Pacific Ocean making an application. Persons as far away as India, Bangladesh, Australia. We have persons all over Europe, the United Kingdom, the United States, Canada, Central America, our Caribbean region, Gulf of Mexico. These are just some of the areas where we are dealing with persons applying. I will repeat at this stage, it is our intention to allow every single national who wants to return, but in a manner as we've been doing, where we will protect the population and those returning by making sure our system isn't overwhelmed. We do empathize with every single national and their family as we go through this difficult time, remembering there still is this global pandemic. The procedure is as follows. We receive an application. The application is considered. We then ask for confirmation of nationality by asking for a copy of the biodata page of the person's passport. We then ask for their proposed flight details. At that stage, it is indicated that they will be permitted entry back into Trinidad and Tobago, so they can use that to go and make their flight arrangements. The final approval cannot be given until we have the final flight details. This is a process, as I was reminding my permanent secretary, we have been through now well over 10, 20 times. So you apply, we consider it, we say provide us with proof of nationality and your proposed flight details. We will indicate in writing that you will be granted approval, and we await the final flight details to return to Trinidad and Tobago. The government does not get involved in the flight details. The government is not acting in a manner where we are making the arrangements for flights. And I'd like to put on record, this process has been working. You all would recall the 33 that returned from Barbados, those that returned from Suriname, those that returned from Grenada, some other private ones. We've had a few come in via vessels who have been outside there, and these types of things. At no stage has the government engaged with any other government to provide any services. Once we indicate to our nationals who have requested, and we are going down that route, for example, the Guyana, the Suriname, the Venezuela, that we're going to grant approval, they can then utilize that to make their flight arrangements. When they provide us with the final flight details, we do grant the final exemption. Because what the final exemption under the hand of the permanent secretary is an indication to our local authorities, the civil aviation or immigration authorities, customs and excise, that these persons will be coming in These are the details of when they will be coming in, how they will be coming in, and we say the crew cannot disembark, etc. We cannot provide that final document until we have the final details. With respect to Venezuela and Guyana, we indicated a few weeks ago that permission would be granted. We have had persons return. We have had over 25 return from Guyana. They made their arrangements. We went through the process I just outlined. They arrived. Last week, we had a national return from Venezuela. She made her arrangements, chartered a plane after we'd granted the exemption, provided us with the details, arrived here, and is currently in state quarantine. I repeat, with respect to Venezuela, that is the process that was used. At no point in time did the government of Trinidad and Tobago get involved with the government of Venezuela with respect to that national's return. So we know that that is the process that is used. With respect to some of the nationals we have now in Venezuela, there seems to have been some confusion. Firstly, there was one individual who was claiming to represent a lot. Then when we indicated to that individual that permission is granted for these nationals to return, another individual popped up with a travel agency. So we're now faced with more than one individual claiming to be representing a group of people. That did not stop us. We continued to say, okay, fine, provide us with the details. We got the biodata pages of the passports. And this is for the return of nationals. We're still faced with some non-nationals asking to come into Trinidad and Tobago. In those circumstances, the answer is no. We are dealing with our nationals first, bearing in mind the state quarantine system. So we had two sets of people claiming to represent those who wanted to return from Venezuela. We did not make it an issue. We said, look, permission will be granted, provide us with the flight details. I'm now seeing it suggested that the government has to get involved to make arrangements with the government of Venezuela. We asked, we made the request, kindly show us where you've made a request of the government of Venezuela for the flight to take place, because they're telling us they're chartering a plane, a Venezuelan airline plane, and we have not been provided with the communication between themselves and the government of Venezuela saying that we need to be involved. But what they may not have known is we already know the process, because we had an individual return to Trinidad last week from Venezuela without the involvement of the government at all. The government is not going to go and get itself involved in what it doesn't need to get involved with. With respect to the nationals in Guyana, we had indicated a few weeks ago that the nationals in Guyana, once you'd made your applications, you would be permitted entry. We've had 25 of them, I believe, enter Trinidad already. We're waiting on the rest. Yesterday, I repeat, yesterday they reached out, 10 persons, it may now go up to 11 or 12, reached out to the Permanent Secretary at the Ministry of National Security and advised us that they believe they're able to make arrangements with a certain charter airline in Guyana to arrive on Saturday. That is part of the process. So now that we receive that, again we confirm in writing, you will be permitted entry to Trinidad and Tobago. Kindly provide us with the final flight details, and that is what I expect to happen, because it's a process we've gone through before. There is no delay on our part. We want to get these persons back. We've been working with the Ministry of Health and their personnel to identify where these persons will be quarantined by the state on arrival. This is a process we've gone through a few times now. So I'm not sure where the confusion has arisen, but I've come here to clarify that from the government's perspective, we have done all that we have to do, and we are assisting the system, and we're doing what we have done before to get these nationals back. With respect to the cruise ships, as you all are aware, we indicated on Friday that we are now prepared to start dealing with the cruise ship workers, our nationals who are on cruise ships. There are a number of vessels in the Caribbean region and outside of the Caribbean region with our nationals on. Fortunately, the two closest ones that were in a state of readiness, we brought back 6 on Saturday, and then we brought back 52. We had granted permission for 53, but one of our nationals didn't disembark on Monday. So 6 plus 52 from 2 different vessels. I, along with a government team, we have been in communication with Royal Caribbean, trying to make the arrangements. One, to find out how many of our nationals are still there. One email said 264 are on the, I think it's Vision on the Seas ship that is now in St. Vincent. Then another email said it was 300, with another 60 on other ships that they would then consolidate. Those are the discussions taking place right now. Of course, in our monitoring of the system, we have seen that some cruise ship workers who have disembarked in Jamaica, Grenada, and now St. Vincent have tested positive for COVID-19. So this is something we're mindful of. If the number, which is what we're seeing, is as much as 360 persons, it would immediately overwhelm our system, because we are also bringing back others, as I've just described, including tonight I'll be having a Zoom meeting with the principals of Mona, Cave Hill, and St. Augustine to try starting making the final arrangements to bring back our students from Jamaica and Barbados. So we're mindful of that as well. That will be well over 200. So the conversation and the communication we've sent to Royal Caribbean is allow us to use your ship to quarantine our nationals. Are you open and available to that? So therefore the nationals can be quarantined, and our health personnel will manage that quarantine process. And that is where we are now. The ball is in their court. I'm waiting for them to come back. But we are mindful that from that same vessel, persons have disembarked in other jurisdictions, and it appears as though they have tested positive. We will get further details on that. So we need to manage the process very carefully going forward. This is not an indication that we will not be taking back our nationals. We will be taking back. But as we've said all along, it will be on a managed schedule that is very fluid, and what our resources can handle. We've been in discussions with the Ministry of National Security, Ministry of Health, to find where we can make more facilities potentially available. So as we get more information with respect to the return of our nationals, including our students, and as we begin to deal with nationals, I have nationals all over the globe, some of them now saying that they will charter their own aircraft to come in. From a fairness point of view, that can't be the test at this stage, because it can't be that someone who can charter a plane and fly in will get precedence over some others who may be having more needy cases. Each case is being dealt with on a case-by-case basis by the government, and all of our nationals will return, but return in the fashion that we've been very, very careful to point out, which is a managed fashion that is not going to overwhelm our system, so we could continue to protect all of our population here in Trinidad and Tobago and get our nationals back safely as well. Thank you very much, Minister Cox.
Thank you very much, Minister. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. 98.1.
Very good Wednesday morning to the panel. Stephen Cummings, 98.1 FM.
Morning.
Questions, one for Minister Dayal Singh and the other for the Minister of National Security. I'll go first with Minister Dayal Singh. Minister, as we talk about changing attitudes and human behavior, even if it means for the personal or public good, culturally and as citizens, we have not been wired really to make sudden decisions easily. Now, safeguarding ourselves against COVID-19, which do you think will be more effective in having us make that adjustment? Gentle but persistent nudging and moral suasion, or should it be we just apply the law as pertained to our regulations? And Minister Young, some U.S. citizens and nationals who are here, they've been asking, when would be their turn to return home. So I'm not sure if there's a schedule that you have in terms of foreign nationals who are in Trinidad and Tobago or who would like to return home. And if you just allow me to ask about the cruise ship issue. Do we have an exact number of persons who are on cruise lines in Caribbean waters, Trinidad and Tobago nationals, as we speak, as we continue to manage this process as well? Thank you.
Okay, thank you, Mr. Cummins. So I'll go with the first, with your first question about changing attitudes. Human society, as we know it, has been built upon millennia of human interaction, thousands and thousands of years. And we have been wired in a certain way. And humans are a very social creature. There's a very good book, a big white thick book called A Brief History of Humankind, or mankind. If you read that book about the evolution of mankind, its habits and so on, your question falls squarely within that book, and the answers are to be found there. There are simply some things that you cannot legislate against. For example, washing hands. I don't think you want the government to pass a law penalizing people for not washing hands. I don't think you want to pass a law that penalizes people and charges them and throw them in jail for not sticking to a 6-foot separation. But there are some things that serious moral suasion can work, like wearing of masks. But also, a lot of onus now goes on to the owners and operators of businesses, where you have the authority to deny service to someone who wears a mask. You have the authority, as I have seen it being done, because I went up to Curup Junction on Monday. I visited the doubles people in the junction to see what they were doing. And I went into a fast food restaurant in Curup Junction to see what they are doing. And I was pleased to see how these people are operating. The only thing that I think, and I've said it before, that the Attorney General is looking at is the wearing of masks in public. We can't legislate and tell people don't hug and kiss again, don't shake hands. But there are certain things that serious public policy, driven by both the public and private sector, can be very effective, and start to build that into our habits as we socialize more and more. So let me just repeat. We can't pass a law for everything, but there is within the law the authority for store owners, fast food restaurant chains, club owners, the same way you see sign, no bareback, no slippers, no short pants. You have that authority to say no service without masks. You have that authority. So we are going to go strong moral suasion, strong policy recommendations that we have signed off on, which most responsible companies are following. And I think that is the way to go for now until the Attorney General comes back to us. Thank you very much for your most important question.
Thanks, Mr. Cummings. I got the first question. I didn't quite pick up the second one. So
actually, he's supposed to ask one more question. So
okay.
Go ahead
All
with the first one.
Thank you, Minister Cox.
Thank you.
The question is to U.S. citizens. I understood you to be asking about U.S. and other citizens who are not nationals, for them to return to their homeland, and then some of our nationals who may also want to depart. The answer is, right now, as you're very aware, there are no commercial flights, but there have been a number of flights arranged by, for example, the Canadian government, the UK government, the US government. Those continue as when they make the request. Yesterday, I was dealing one request from one of our nationals who is a young doctor who said she got a contract to go and work in Ireland and she would like to go. The answer is yes, we would grant the exemption for you to leave Trinidad and Tobago. Of course, there's no guarantee as to re-entry, but I'm not sure she's interested in that at this stage. But once there are flights, at this stage, we continue to manage our borders very carefully, and there are no commercial flights. But there are flights being arranged by certain governments, and persons working with their governments are leaving on those flights.
Thank you, Minister. TV6?
Hi, good morning, everyone.
Good morning.
So I have quite a few questions, but I'm only allowed to ask two, so I'll try to get the two most important ones in. There was a public notice given out by the Ministry of National Security some time ago speaking on the closure of the Work Permit Secretariat. And given that these offices are now closed, once the borders are reopened, how will expats be able to come in and work? And seeing that there's a lengthy process where permits the process could be from 2 months to 1 year. How is the ministry planning to handle this? And now that the St. Vincent and Grenadines crew members from the Division of the Seas have tested positive for COVID-19, are we still considering having the 300 plus nationals quarantine on board?
Minister.
Okay, thank you very much. With respect to the first question, as I'm sure you're aware, yesterday a further release was put out by the Work Permit Secretariat, the Citizenship and Residency Unit, at immigration. Firstly, let me say there's no work permit application that's outstanding for over a year. In fact, we've speeded up the work permit application. We've actually been dealing with them quite efficiently, I must say, within recent times. Citizenship and residency is another area and comes under a different department. No one is being prejudiced. There have been extensions granted during this period, and whilst those areas are closed, no one is being prejudiced. So what we've said is persons who have permission to be here, we've extended it. We're dealing with, for example, energy workers who are coming in to continue our energy facilities working, especially our offshore rigs and this type of thing. We've been granting the work permits. With health workers, we've been granting work permits. Every time I go into the office, I'm still continuously signing work permits. So that has not been affected by the fact that the office is closed. What we've said to those who may have a stamp in their passport to a date that expires during this period of stay at home, we've granted effectual extensions, and they will get their new appointments, etc.
Thank you. ACP News.
Hi, good morning. Pryor Harry, ACPnews.com. Minister Young, we have been in contact with a number of nationals in the states, who have come together. Some in BVI also. They are trying to make arrangements, but one of the issues they are having is that when they go to the airlines want permission first from Trinidad. So I just wanted you to see if you can work out some arrangements to help them in that aspect, because they're having some difficulty in booking the flights. And my second question too is maybe more on a personal note, as there have been some calls for you to resign. I don't know if you have, what is your take on that? Have you considered that? And is it, affecting you in any way?
Pryor.
All right, thank you. It's okay with
the first question. The second question, is that COVID related?
Yes, of course, because it dealt, the calls came from certain issues that arise out of COVID, the visit by the Venezuelan VP, and also the issues of the Rio Treaty. So those
all right,
Minister.
Thank you very much, Minister Cox. And Pryor, just before we go there though, I remember there was a second question TV6 had asked me. Let me just very quickly answer it. My apologies. With respect to the Vision on the Seas ship that is currently in St. Vincent, last night we reached out via communication to the executives of Royal Caribbean, asking them a number of questions, and questions related to how many of our nationals on the ship, what is it that they propose with respect to the health aspects, etc. The Chief Medical Officer, the Minister of Health's team are working along with national security, so that is a work in progress. We will make decisions as we get further information. As I say, it's a work in progress. To get to Pryor's questions now, as I said, and I was at great pains to explain just now, we have gone through the process of airlines all over the world right now. The first thing is you say, yes, we will grant approval, and the airlines will work with that. You can't give final approval until you have the date, the time of the flight, who are going to be the flight crew, and these types of things. So there is already a working system. With respect to persons who may be in BVI, etc., you're not going to get permission to enter Trinidad and Tobago just because you can get on a plane and come here, because you can afford to charter a plane. As I've explained this morning, as we've explained before, we are managing the process, we're managing the numbers, and that will continue to be our procedure and how we deal with it. So it is not that you can hire a plane somewhere and come in. We're looking at how many people are in that area. There are a number of different factors, as I've explained this morning. With respect to your question, with the greatest of respect, my resignation doesn't arise out of this COVID conversation. And the answer is no. Quite frankly, I have not seen the reason for resignation. I've listened very carefully. I've noted the quarters that this come from. I've also noted 2 corrections in the newspaper. Very small corrections, one in the Newsday, one in the Express, which is where a lot of the whole misconstruing came from, that I was quoted as saying something that was then relied on by our US allies. That is what we were told, and that turned out to be wholly false. And even after the Hansard was put into the public domain and sent to the media, it was still scoffed over, and that repeat of a misquotation of me took place. I am here to serve the people of Trinidad and Tobago, and I will continue to do so. staying true to my oath without fear or favor, malice or ill will, and definitely to the best of my ability.
Thank you, Minister. I-95.5.
Good morning to everyone. With the lieutenant from I-95.5. Minister Young, I'll start with you first. Can you give us the number of exemption requests you have received thus far and the number of requests that have been granted? I know you won't ask exact figures, but if you have ballpark figures, those will do fine. And part B, with respect to the re-entry of nationals, is it that they must all come through PIACO, or will they be allowed to re-enter via the A.N. Robinson International Airport as well? And for Minister Alleyne,
Hello. We have your two questions. Thank you. If we have time, we will get back to you. Okay?
Thank you.
Once we have time, we'll get back to you, Whitfield. Thank you. Minister Young?
Thank you, Whitfield and Minister Cox. I love how the media starts and say, well, I want to ask this. Very, very quickly, with respect to your second question with the A.N. Robinson, the answer is no. We are not restricting it as to where you can come in once it's a legal port of entry. So, for example, there have been some workers who have returned off of ships in the energy sector, and I last week granted approval for a UTT student, a young boy who is doing his UTT maritime degree, and he was on a methanol ship, a methanol tanker, and it came into port in Trinidad. And of course, I mean, it would be inhumane in those circumstances to turn him away. So he was allowed in. So we have those types. I don't have the exact numbers of figures, but as I say, there are thousands of applications, and on a literally an hour and by hour basis, we continue to receive applications from around the world. You all are aware of the vast majority of the exemptions because all of them are told to you all. There may be a few in between, like the one I just mentioned, that were not. So we've had it come in on a few ships, like some of the crews who came in from Guyana. There were 3 who came in from a ship. I don't have the exact numbers, but that is something that could be provided in the future. There's absolutely no problem in providing the number of exemptions that have been granted.
There was a second question you answered.
I answered the second question first, which was, will they only be permitted through PIACO? So the answer is no, through legal ports of entry, but we're managing it.
Thank you. 91.9.
Hi, good morning, everyone.
Good morning.
Good morning.
Ivan.
Hi. All right, so I just have 2 quick questions. Are we able to test for all strains? This might go to Dr. Parasram. Are we able now to test for all strains of COVID-19? I think the last report that I saw would have said that we have 3 strains of COVID-19 in the world. We are at a place to test for that, considering we are taking so many nationals and persons from various locations now. You know, we may be exposed to strains that we may not have seen before. Are we ready for that? And also, it's a key question here to ask: how could persons be on a ship, claim to be tested, and come off positive? What is happening with respect to those ship tests, and why are we seeing people coming off in territories that are positive? Those are my 2 for now, please.
I think these questions, Dr. Parasram.
So just with regards to the strains, so CARPA is not able to tell the difference between COVID-19 strains as yet. Of course, we can tell the difference between coronavirus types. The University of the West Indies has been in the process of actually looking at mapping the genome of the virus that is occurring in Trinidad. So I have discussed it with the Dean of the faculty. It's in the very early stages. I assume it will come to the Ethics Committee of the Ministry of Health as well before that study is done, and we will, of course, if it is approved, we will allow them sampling from our cases that we would have had so that the genome and the substrains can be mapped in Trinidad and Tobago. With regards to the testing in ships, so I've been in communication. Let us take the one in St. Vincent, for instance. I've been in communication with the CMO from St. Vincent, who has indicated to me that certain persons aboard the ship have been tested positive based on a serological test, which is basically an antibody test. They have tested positive for IgM and IgG. The next step is that she is going to take samples from all the members from St. Vincent and have that tested by the polymerase chain reaction test, which is the test and the gold standard that we use in Trinidad. Now, our IgM, IgG at its best will give you results based on the antibodies in your system 10 days and beyond usually after getting infected. So it doesn't tell you generally or necessarily that you have an active infection going on. So PCR will elucidate whether there's an infection, active or not. Also, bearing in mind that we had discussions about serology, I don't know what type of serological tests are being used in those islands. We have noted significant concerns with serological tests in terms of their specificity and their sensitivity, most of them having at best 50 to 60%. So let us wait on the results of the PCR, and then we can make a definitive judgment or hypothesis based on those results, which are the gold standard.
Thank you. Luke Titi.
Hi, good morning, everybody. Nika Pasnal here from Luke. I just have one question for Minister Young. Minister Young, we've seen international news discussing new policies, airport policies, mechanisms for passage through these airports and travel in general. Has our immigration division begun to put things in place for when the borders finally do open? And can you tell us if any at all have been discussed or are in the works for us?
Okay, thank you very much, Ms. Parsonal, for that question. That is not dependent on immigration, but immigration is part of the whole formula. The answer is yes, discussions are afoot, civil aviation, immigration, customs, but we're also part of CARICOM. There is a CARICOM Heads of Government Committee that is also looking at these issues, and we are taking advice from our health experts, etc. So it is something that we're in the process of looking at, because we are very, very mindful that the airports, international airports, continue to be an area where the virus is spread. And when one is looking at the reopening of the borders, as you say, this is something that is important. So the answer is yes, we are looking at it. Up to a few weeks ago, I had civil aviation reach out to me that they are part of an international discussion taking place, and that is how we're looking at these things right now. Then to come together to decide how best it could be done and how safely it can be done. But I think we're still a little way off from that right now. I don't think international travel is a great idea at this stage.
Thank you. News source.
Hi, good morning.
Good morning,
Rhoda Barrett.
Morning.
And this question, this morning, I think this question would be best suited for the Minister, but I will direct it at the entire panel. Minister of Health, Minister, I've been looking at the new normal guidelines that have been put out, and I was wondering about how pragmatic it would be really for the education system, and whether or not there would be alternate measures or another version of new normal for classrooms, because the whole business of masks and facial distancing within the physical constraints of classrooms don't seem to be as practical as they would be for other institutions.
Thank you. The general guidelines that were put out are general guidelines. We have been working with the Ministry of Education. As a matter of fact, there was a meeting at the Ministry of Health with education officials, and CMO could jog my memory, I think last week or week before, to start to work out a separate policy framework to deal with education, because education poses unique challenges that may not be easily solved by workplace protocols. So I knew that we had those discussions with education maybe week before last, and CMO could probably remind me if I am wrong.
Yeah, so we did have a meeting where the Permanent Secretary of the Ministry, myself, as well as the Permanent Secretary at Education and their Chief Education Officer, would have met to discuss reopening of schools later on in the year. There's a specific WHO guideline for school reopening that has been shared with the Ministry of Education, and we had discussions on it. The critical parts of the guideline for schools that are pertinent are basically, it is very difficult to do social distancing for children, as I have said on this forum many times before. Social distancing is extremely difficult in a classroom setting as well. So what we have to rely on is frequent hand washing. We have to rely on frequent sanitization of frequently touched surfaces, for instance, doorknobs, desktops, those kinds of things, chairs, etc. And the most critical one is that children need to stay home, and teachers as well, if you are ill. so that we don't get ill persons in that environment. Because once you get ill persons in a school environment, that virus or that disease tends to spread very quickly throughout the school environment, as we have seen with gastroenteritis, we have seen with hand, foot, and mouth disease, we have seen with influenza and the normal common cold. We expect that the same will happen with COVID-19 if that becomes introduced into that environment. So the guidelines are there.
Sorry. And Rhoda, that is why at the very start, the public health measures we are asking, wearing of masks properly, hand sanitizing, it is these simple measures that will limit and prevent as far as possible the entry into the virus in the school community. I don't think there will be a guarantee, but if we do the common sense, inexpensive measures, the public health measures, I think we should be able to manage it. But so much of this post our first wave response now rests with the individuals to do the right thing. As I said to Mr. Cummins' statement, first question, you can't pass a law against hand washing. So policies have to be very strictly enforced, whether in the private sector, the public sector, and now within the school environment by principals, by deans, and parents. Parents are going to have a huge degree of responsibility now to make sure that their sick children don't go to school. PTAs will have to come in. So it's going to be a real collective effort to protect our schools. Thank you very much.
Okay, before I move on, Minister Young, there's a question asking about bringing home 8 citizens who are stranded in India. What is being done?
Okay, so we have been in contact with representatives on behalf of them. There seems to be a system where there's obviously no direct way from India to Trinidad. So they are making their way to London, to Canada, to all of these places. So what we've said is go ahead, make your way when you reach to your last destination to then make your way into Trinidad and Tobago. At that stage, then engage us, and that's how we have to deal with it, because there's nothing I could do from here to help them in India. They have to go, as I say, London, Canada, Miami, wherever it is. It's only when you're ready to make your way directly into Trinidad our system gets engaged.
Okay, thank you. Tobago Channel 5.
Good morning.
Morning.
Candice Jackson from Tobago Channel 5.
Morning, Candice.
Yes, my questions are probably for the Minister of Health or the CMO. Has there been anyone from our caseload that has submitted themselves for testing the arrangements made by PAHO and so on for the research that we are supposed to be taking part in? Also, given the warning from the PAHO director to protect people in the Americas with non-communicable diseases from COVID-19, are there specific guidelines for persons in this group to follow, especially for those who have difficulty wearing masks, or will the general guidelines suffice?
Okay, so thank you, Candice, and you look like 14 years and 1 week. Remember, it was your birthday last week, and I said you look like 14. So, as far as the research is concerned, Candice, the research team met this morning just before coming to this meeting, and we are developing the specific questionnaire instrument that will be applied to the 108 people in Trinidad and Tobago who survived COVID. So yes, that is on the way. And that is being led by Dr. Anthony Parkinson. The other parts of the question I will leave for the Chief Medical Officer. But before I go, Mr. Cummins, the book I was talking about, Sapiens, A Brief History of Mankind by Yuval Noah Harari. I recommend it. CMO.
So if I could just get a quick review of your question. I didn't get the group that you were speaking of.
But these are the persons with some non-communicable diseases, and they are having problems wearing the mask, and because it can actually pose, in some cases, can pose more hazardous. It can do more harm than good. Right. So they want to know for those persons what are the guidelines, because they're having issues even like when they go to the groceries and so on. And I mean, these persons are the ones that they really can't wear the mask, and then they are denied going in because of the policies that businesses are being asked to accept, which is no mask, no service.
Right. So in terms of wearing masks, as we described before, we have to seek your medical attention before, right, to figure out for those particular individuals with chronic obstructive pulmonary disease, asthma, and the like, if they can wear the mask, one. Persons, the alternative to, if persons have an alternative individual in their household that can go to those areas, it might help. There may be a letter that can be written by your physician to support you not being able to wear that mask when you go out as a sort of exemption to some extent. That you can carry on your person. That is a possibility with dealing with those scenarios. But I think the best way might be to circumvent and try to get someone to do your shopping for you. There are other online alternatives. For instance, certain groups are now doing, by way of apps, deliveries to your vehicle, that sort of thing. So we have to look at new ways to do our shopping, etc. as well.
Candice raised a very important question, and the CMO and I will try to explain this further, because the issue you have raised, that certain individuals can't wear masks. That is why it is so important for those who can wear masks to wear masks. And I'll give you an example. When we vaccinate people against, let's say, mumps, measles, rubella, we try to get up to about 97%, and the CMO can back me up on this if he wants. Because we will always recognize there may be a few children, because they are allergic or some other condition, who can't be vaccinated. So those people who can't be vaccinated rely on the other 98% of the population to be vaccinated to protect them. I don't know if you see where I'm coming from. Same thing with masks. There may be people with asthma, COPD, maybe allergic to cloth, I don't know. It will be a small percentage. So the way to protect them who can't wear masks for medical reasons, just like immunization, if 99% or 90% of the healthy population could wear masks, it means we could protect those who can't wear masks for medical reasons. CMO, did I do well there?
Yes, so we're getting into the realm of herd immunity.
Correct.
And protection of the population by our measures that really can't protect themselves.
Okay, thank you. Sunilala.
Hi, good morning. Sunilala from Caribbean Lifestyle Communications. Minister Young, there was a BBC report this morning that said a human rights watch group is warning that the Venezuelan healthcare system is not prepared for the pandemic. They're saying that Venezuela has over 1,000 confirmed infections of COVID-19, and adding that the situation in the country may drive people to leave the country, which can further strain the health systems of neighboring countries. Now, my question is, are we prepared for this type of influx where Venezuelans may flock to nearby countries, including TNZ?
Sudal, I have to smile and I have to chuckle to myself, because when we've told the country that exact question that you've just posed was on our mind in March of this year, and that is why we met with the Vice President of Venezuela, no one wanted to accept it. But we were looking at that as way back as March of this year. That is the discussion that we had with the Vice President of Venezuela with respect to what are the measures they are putting in place to deal with COVID-19, how it is they intend to deal with it, that we are concerned because we already have 16,523 registered Venezuelans, and we know that there are few more than that here, and that Trinidad and Tobago needs to be able to protect its borders, etc. What I can tell you is our border protection has been working well. You all would have seen recently a boatload of 32 Venezuelans come across. We intercepted them. They were repatriated to Venezuela, handed back over to the Venezuelan authorities. So it is always a concern of ours. Right? COVID, of course, escalates the concern. What we do is we continue to utilize all of our state's resources to protect the borders of Trinidad and Tobago and the population. But I think any sensible and logical person would recognize and accept that part of that protection has to be an open channel of communication with the Venezuelan authorities as well. It has to be a two-way street, and that is what we have been doing.
Thank you very much. TTT?
Good morning, Crystal Wilson, PTT Limited, and my question is for the Minister of National Security. Please forgive if this has already been addressed and it might have been missed, but we've continued to receive a number of calls from members of the public, some of them whose passports have expired or others are due to expire soon, with governments carefully manage repatriation. Can you tell us what's in place for passport renewals as it regards arrangements to get them back home?
All right, Crystal, I have to smile when you threw in there governments carefully manage repatriation, right? I think that is a multifold question. Let me start by saying that we have used the time, we have upgraded the systems as I had indicated. I actually signed off on a ministerial direction approving that I think we've produced about 44 to 49,000 passports that we have now in our possession to distribute. We have entered into an arrangement with TT Post, and we will be giving people the option for us to mail these passports to them rather than persons come in. So that's going to be the passport delivery exercise taking place. We have received a number of requests from persons who are outside of Trinidad and Tobago who may have had expired passports, or a child born to two Trinidad and Tobago parents outside of Trinidad and Tobago and they don't have any Trinidad and Tobago documentation, up-to-date documentation in their hands. As I've said, as soon as we reach to them and their re-entry into Trinidad and Tobago, we are not going to allow this to be a hurdle in the way of them returning. We can issue emergency travel documents. We will do so where necessary. With respect to the passport offices being open, my understanding, I've kept inquiring of the permanent secretaries, is that the immigration offices have been reopened. With respect to passport applications, there's a process and a procedure in place. But of course, in this new normal with social distancing and these things, they are looking at a number of different measures. And I'm glad that we got the TT Post measure on board. So it means less traffic into the offices. We are not going to allow someone's expired passport who may be outside of Trinidad and Tobago, and when their time comes to return to Trinidad and Tobago, prevent that from them returning. I can give that assurance. I've already told persons we will issue the travel documentation, the emergency documentation. And this is not something that's being faced by Trinidad alone. Every country in the world that has shut its borders are facing these things, and we will just work together with persons.
Thank you. TTT? Well, TTT, any more questions? That's just one question.
That would be it for now. Thank you.
Okay, thank you. Express?
Good morning, Camille Hunt, Express.
Morning, Camille.
I have two questions for Minister Young. Minister, there is the case of a national who returned from the Disney cruise, but her husband, who was on the same cruise, he was not allowed in because he's a Jamaican national. But he has been living in Trinidad and his residency application has been pending for a number of years. So can you explain how these issues are being treated with? Because in this case, Trinidad has been this individual's home, and it seems like now he's being torn away from his family. Also, there have been complaints from staff at the immigration office that although they've reopened for passport appointments and so on, they're not satisfied that enough is being done to protect them. They're saying that there are no protective screens, no hand sanitizer dispensers, and so on. Can you address these concerns, please?
Thank you very much, Camille. Yes, both of those stories are in the Express. Dealing with the first one, the answer is simple. As I've repeated here this morning, we are dealing with nationals. When we had closed our borders on the 17th of March to non-nationals, there were a number of persons in similar circumstances. We made it very clear at that stage that if you're non-national, you're non-national. At the end of the day, you're not being permitted entry. This is not a usual or normal time. You know, if you allow the entry of one non-national, how do you then differentiate with other non-nationals and that wave of influx of other non-nationals who, and there are persons who would claim that they're living in Trinidad, they have applications for residency. And now put yourself in the shoes of the nationals, who there's no question as to their nationality and their citizenship of Trinidad and Tobago. You're now going to be telling them you are outside, wait to return, but I'm allowing non-nationals in. So it's quite a simple policy. At this stage, we're only dealing with nationals. And this is something that's taking place all over the world. I guarantee you that. If you're a citizen of the United States and your spouse is not a citizen of the United States, it matters not. So that's with respect to that first question. It is not a normal, it is not usual, and we are dealing with it, but we are being fair to our nationals, and that is how we have to deal with it. With respect to the second one, I read in the newspapers these claims from anonymous immigration staff, and immediately upon leaving here, when I go back to the Ministry of National Security, it is something I'm going to look into, because at the end of the day, I believe we as a government want to make sure that every government worker is provided with a safe environment, especially in these circumstances, and there is the need for additional safety barriers and these types of things, so that has to be addressed, provided it is true, and I have no reason to doubt that it isn't. I am going to look into it and deal with it, but once again, the first I heard of it, saw of it, read of it, was in the newspapers.
Minister Young, I noticed on Facebook there has been some agitation from members of the church, and some of them are saying that the church is being unfairly treated. They probably felt that they should have been in an earlier phase. Any comments on that?
Thank you very much, Minister Cox. When the team meets, and that is the cabinet-appointed team, which is the Minister of Health and his medical experts, the Minister of National Security and the Prime Minister, we're constantly reviewing the process. We are constantly looking at what can be reopened. We are very aware of the need for churches and how they feel there's a need to allow them to get back into their congregations. This is something that is on our radar, is something that will continue to be given consideration. We will be guided by the medical health experts. I mean, we have had cases that we've observed all over the world. For example, in South Korea, you had one instance that was the first wave for them, where it was as a result of church and persons in church, etc. It is not going to prevent us. In fact, yesterday there was a conversation. We're looking at what's going on in Italy, for example, and they've allowed persons back in the church with proper social distancing. The Prime Minister was telling me persons come in through one door, leave through another door, so there is absolutely no intermingling. So these are the types of things that will have to be employed. We don't want anybody to be prevented from worshipping God. Our Muslim brothers and sisters just came out of one of the most important periods for them, Ramadan, where they weren't able to go and congregate in the mosques. So it is something that we're going to be looking at. And once we're guided by the medical health personnel, I can assure you, all of our worshippers of different faiths, it is something that is going to be looked at and addressed.
Let me just come in here briefly on places of worship, because that poses a particularly unique challenge to us. Yes, we want all places of worship to be operational as soon as possible. But when one looks at the demographic of people who attend places of worship, whether it's a church, a mosque, a mandir, a cathedral, it tends to be who? People over 50, over 55, over 60. It is the elderly that makes up the bulk of the followers of religion that go to places of congregation. And all the evidence around the world, including our 8 deaths in Trinidad, have mainly come from the elderly population. And that is what keeps me up at night, thinking about how do we open up places of religion. Because it just takes one person in a religious setting where you have people with comorbidities like diabetes, hypertension, cancers, who cannot, whose immune system, and again, the CMO will come in here, whose immune systems would not allow them to fight off the COVID virus. If you look at the 41 deaths we have had due to H1N1, the vast majority of them come from the elderly. And these are the same elderly who make up the bulk of people who go to Christian churches, the mandirs, and the mosques. So they pose a particular challenge for us, and it's something that really keeps me up at night, thinking about how do we protect these elderly people? How do we protect them? It's a very difficult balancing act, and is one that we'll have to pay particular attention to. Thank you very much.
Thank you. Dr. Parasram, could you comment, please?
No, I think the way we protect them is to ensure that the guidelines, and again, WHO has a separate guideline for churches and congregation and mass gathering, that we need to really have that get to a stage that we are all aware of it, and it is actually being reached to a point that it can be practiced well. We have seen that, because it's congregation, we're still trying to go with the 5 and less rule in terms of the regulation. So that regulation needs to stay for now. So it will be considered like all other activities that are not in the first few phases at a later time, once we are able to determine how those guidelines can be rolled out and how everyone can be protected.
Okay, thank you. Newsday.
Good morning, everyone.
Good morning.
Gonzalez from Newsday. I have 2 questions, one for the CMO and one for the Minister of National Security. Dr. Parasram, I would like to know, based on the current development on moving phase 2 forward and our numbers remaining consistently low, what advice would you give to the nation and the Prime Minister on moving into the next phase? And is there any consideration to probably advise the Prime Minister on moving phase 3 forward and probably phase 4? And my second question, I would like an update on the Coast Guard officers under quarantine at the Citrus base. Thank you.
Okay. Dr. Parasram?
So in terms of the phases, as we have been doing throughout, I would have met with my multi-sectoral team yesterday, and we had a discussion, of course, the tenets of phase 3, phase 4, phase 5, etc. We have a prescribed timeline for everything to occur. We have to bear in mind that so far, case 115 was on the 20th of April, which gives us almost 37 days without an active case. Case 116, which seemed to be a linked case, is giving us just on over 30 days without a case. So we enter about 2 cycles and a half. So we are bringing the phases forward based on that. So the initial 14-day was to give us 14 days space in terms of the incubation period of the virus between one phase and the next, given that there would have been cases in each phase. Now that we have no cases in each phase, the recommendations and the Prime Minister has indicated that there would be an adjustment in terms of the timelines, but that adjustment needs to be discussed with the Prime Minister, and we will wait for him to, as he has done with the other phases and Minister had said, to call us into that meeting where we discuss our recommendations, and then he will ultimately make the final decision as to when and where those phases will lie. And if we can move aspects of phase 4 into phase 3, we will have that discussion. That discussion has not occurred as yet.
Minister Young.
Thank you very much, Mr. Cox and Newsday. First of all, let me correct the record once again. There is no quarantining of any Coast Guard officers taking place at the Cedrus base. On the day that there were events with the 33 nationals of Venezuela being intercepted, the Cedrus base was closed for a very short period of time. It reopened on the exact same day. There appears to have been some narrative that took off that Cedrus base was shut down and this type of thing. The Coast Guard men and women continue to be quarantined. They're quarantined on TTDF facilities, and they continue to be monitored by the TTDF medical personnel, as is consistent with the protocols, the health protocols that were accepted by the Trinidad and Tobago Defense Force for these types of situations. So it is completely in keeping with the current policies and procedures, and they are going through the recommended protocols and procedures.
Thank you very much. We are out of time. We've come to the end of today's virtual media conference. Do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. Our next media conference is on Saturday, May the 30th, and we will be joined by the Prime Minister, Dr. the Honorable Keith Rowley. Today, before we go, I want to thank those who responded to the Ministry of Communications' call to volunteer as Spanish translators. Antes de finalizar, yo quiero agradecer a aquellas que respondieron al llamado de ser voluntario del Ministerio de Comunicaciones como traductores al español. Your selflessness and sense of duty to country allowed us to reach our Spanish-speaking population and ensure they are getting the messages of the government during this pandemic. For this, we are grateful. We thank you for your service and giving of your time freely. It is appreciated. Les damos las gracias por su servicio y el ofrecer su tiempo de manera gratuita. Lo valoramos. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to flatten the curve and beat COVID-19. Stay home, stay safe. May God bless Trinidad and Tobago. Yo soy Donna Cox, Ministra de Comunicaciones. Gracias por acompañarnos hoy mientras el gobierno continúa sus esfuerzos para aplanar la curva y vencer al COVID-19. Quédate en casa. Cuídate. Que Dios bendiga a Trinidad y Tobago.